1. General Introduction. Dr. Leslie Kernisan is a board-certified geriatrician and the founder of the health information platform Better Health While Aging. In this presentation, she focuses on an issue that is both critically important and frequently encountered in her clinical practice: how to help older adults live healthier lives, especially in the context of concerns about memory loss and overall brain health. The central topic of the video is a class of medications that are extremely common yet potentially dangerous for older adults, known as anticholinergic drugs. From a geriatric medicine perspective, these medications should be identified early and reduced whenever possible because they can slow brain function, trigger or worsen memory impairment, and have even been linked to an increased risk of developing Alzheimer's disease and other forms of dementia. Although the harmful effects of anticholinergic medications on the aging brain have been studied and documented for decades, these drugs continue to be widely prescribed in modern medical practice. Moreover, many commonly used over-the-counter medications, such as the allergy drug Benadryl, also fall into this category. Clinical experience shows that a large number of older adults are taking at least one, and often several, anticholinergic medications, without realizing the potential risks these drugs pose to their brain health, too. Why do older adults continue to use anticholinergic medications so frequently? The widespread use of anticholinergic medications among older adults stems primarily from two major factors. First, most patients are not adequately informed. The majority of older adults have never heard the term anticholinergic medication, nor are they aware that many familiar drugs, including common over-the-counter products, can negatively affect memory and cognitive function. Lacking this foundational knowledge, they are unlikely to recognize potential risks or to question healthcare providers about the long-term safety of the medications they are taking. Second, most physicians are not extensively trained in geriatrics. In standard medical education, medication management tailored to the aging process is not always emphasized. As a result, many clinicians prescribe drugs based on their short-term effectiveness in relieving symptoms, without fully considering that certain medications become significantly more dangerous as patients age. This gap has long been acknowledged as a systemic issue within the quality of healthcare delivery for older adults. Commentary 1. The problem is not individual fault, but rather a structural gap in medical education and health communication. Commentary 0. When patients are equipped with accurate, relevant knowledge, they are far better positioned to take an active role in protecting their own brain health. 3. Why do older adults continue to use so many anticholinergic medications? Another key reason anticholinergic drugs remain widely used among older adults is that they often provide rapid, noticeable symptom relief. These medications can reduce allergy symptoms, promote sleep, ease urinary urgency, relieve dizziness, alleviate nerve pain, or reduce muscle spasms. When patients experience quick improvement, they are inclined to continue using the medication, often without realizing the subtle but cumulative long-term effects these drugs can have on brain function. In addition, many common problems in older age, such as insomnia, nighttime urination, chronic pain, dizziness, or persistent itching, are notoriously difficult to treat definitively. Given the constraints of limited appointment time, prescribing medication becomes a faster and more convenient solution than non-pharmacological approaches like lifestyle changes, physical therapy, or behavioral interventions, which require more time, sustained effort, and close follow-up. Furthermore, in many cases, anticholinergic medications were first prescribed years earlier when the patient was younger and had no memory-related concerns. As the patient ages, these medications are often continued out of habit, even though the risks to brain health steadily increase over time. The lack of regular, systematic medication reviews allows drugs that are no longer appropriate to remain on treatment lists, contributing to prolonged and unnecessary use among older adults. 4. What are anticholinergic medications? Anticholinergic medications are drugs with chemical properties that block or reduce the effects of acetylcholine, a neurotransmitter that plays a critical role throughout the body. Acetylcholine enables communication between nerve cells not only in the brain, but also across multiple organ systems. In the brain, acetylcholine is directly involved in essential cognitive functions such as thinking, learning, memory formation, and information processing. When acetylcholine activity is inhibited, signal transmission between neurons becomes less efficient, leading to mental slowing, reduced attention, and impaired memory. Beyond the brain, acetylcholine is a central component of the autonomic nervous system, particularly the parasympathetic nervous system, which regulates the body's rest and digest functions. Through this system, acetylcholine influences the eyes, salivary glands, intestines, bladder, and many other organs. When anticholinergic drugs suppress acetylcholine, users may experience side effects such as dry mouth, dry eyes, constipation, and urinary disturbances. Because acetylcholine is simultaneously essential for brain function and for many vital physiological processes, blocking its action, especially in older adults, can lead to a wide range of unintended consequences, with particularly serious implications for long-term cognitive health. 5. Side effects of anticholinergic medications. Anticholinergic drugs can cause a wide range of side effects because they interfere with acetylcholine activity throughout the body. At a mild level, users may experience symptoms such as dry mouth, dry eyes, constipation, urinary retention, or blurred vision. While these effects are often dismissed as minor, in older adults they can significantly reduce quality of life and lead to complications such as urinary tract infections, chronic constipation, or persistent physical discomfort. The most concerning effects, however, involve the brain. When acetylcholine in the brain is suppressed, cognitive function declines, resulting in drowsiness, mental fog, reduced concentration, and slowed reaction time. These changes substantially increase the risk of falls and especially serious danger for older adults who may already have osteoporosis or impaired balance. For individuals who already have cognitive impairment, dementia, or Alzheimer's disease, anticholinergic medications can worsen existing symptoms, accelerating declines in memory and behavior. Commentary: many people accept drowsiness as a harmless side effect, but in reality, it is often a warning sign that the brain is being suppressed and is no longer functioning at its optimal level. 6. The link between anticholinergic medications and Alzheimer's disease. One particularly important point is that anticholinergic drugs act in direct opposition to the medications currently used to treat Alzheimer's disease. Common treatments such as donepezil, Aricept, are designed to increase acetylcholine levels in the brain by slowing its breakdown. This therapeutic approach is based on the well-established fact that people with Alzheimer's disease have reduced acetylcholine activity, which contributes to cognitive dysfunction. In contrast, anticholinergic medications decrease acetylcholine activity, inadvertently undermining the very brain processes needed to preserve memory and thinking ability. This creates a clear contradiction in clinical practice, especially when a person is being treated for Alzheimer's while simultaneously taking anticholinergic drugs for other conditions, such as insomnia, allergies, or urinary problems. Large observational studies have shown that long-term use of anticholinergic medications is associated with a higher risk of developing Alzheimer's disease and other forms of dementia later in life. Although this association does not conclusively prove causation, the existing evidence is strong enough that geriatricians approach these medications with particular caution when prescribing them to older adults. For this reason, within geriatric medicine, systematically reviewing and minimizing anticholinergic medications is considered a critical step in any long-term strategy to protect brain health. 7. Common anticholinergic drug groups you should know. 7.1. Sedating antihistamines. One of the most common and important anticholinergic drug groups that older adults need to be aware of is sedating antihistamines. These medications are widely used to treat allergies, colds, or to aid sleep, and most are available over the counter, making them especially easy to access. A classic example is diphenhydramine, commonly known by the brand name Benadryl. While effective at relieving allergy symptoms, diphenhydramine has strong anticholinergic properties that cause significant sedation. In older adults, this sedative effect goes beyond simple sleepiness. It can lead to confusion, memory impairment, slowed reflexes, and a substantially increased risk of falls. Many people use diphenhydramine as a temporary sleep aid without realizing that suppressing acetylcholine in the brain can have harmful effects on cognitive function, particularly when the medication is used frequently or over long periods of time. It is important to note that not all antihistamines carry the same level of risk. Newer non-sedating antihistamines, such as loratadine, have minimal anticholinergic activity and are generally considered much safer for the aging brain. Therefore, when treating allergies, non-drowsy antihistamines should be preferred over older, sedating options whenever possible. 7.2. PM pain relievers and cold medications. Another commonly overlooked group of anticholinergic medications includes pain relievers and cold remedies labeled PM. These products are marketed to relieve pain or cold symptoms while also helping users sleep at night, which makes them particularly popular among older adults. Well-known examples include Tylenol PM, Advil PM, NyQuil, and similar products. A critical point to understand is that the sleep-inducing effect in these medications does not come from the pain reliever itself. Instead, manufacturers add a sedating agent, most often diphenhydramine or doxylamine. Both substances have strong anticholinergic properties. While PM medications may make it easier for older adults to fall asleep, they also increase the risk of confusion, temporary memory impairment, nighttime dizziness, and falls, especially when getting up to use the bathroom. With regular or long-term use, these effects can contribute to lasting negative impacts on brain function. In most cases, if pain relief is needed in the evening, older adults should use a standard pain reliever without added sedating ingredients. If insomnia is the primary concern, it is far more appropriate to discuss safer alternatives with a physician, including non-drug approaches, rather than relying on PM products that contain anticholinergic components. 7.3. Medications for overactive bladder. Another common group of anticholinergic medications includes prescription drugs used to treat overactive bladder, a condition frequently seen in older adults and characterized by symptoms such as urinary urgency, frequent urination, or incontinence. Because these symptoms can significantly disrupt daily life, many individuals rely on medication for symptom control. Commonly prescribed drugs in this category include oxybutynin, tolterodine-detrol, and sulfenacin, Vesicare. These medications work by blocking acetylcholine in the parasympathetic nervous system, allowing the bladder to relax and reducing involuntary contractions. However, this same mechanism gives them strong anticholinergic effects. In older adults, use of these drugs can lead to side effects such as dry mouth, constipation, drowsiness, confusion, and most concerning negative effects on memory and concentration. These risks are even more pronounced in individuals who already have cognitive impairment or are at increased risk for dementia. Importantly, medications are not always the only option for managing overactive bladder. Many cases can improve with alternative approaches, such as adjusting fluid intake, bladder training, pelvic floor physical therapy, or using newer medications with a lower cognitive risk profile. For this reason, before committing to long-term use, older adults should have a detailed discussion with their physician about the benefits and risks of this class of drugs. 7.4. Medications for dizziness, motion sickness, and nausea. Another group of anticholinergic medications commonly used in older adults includes drugs prescribed for dizziness, motion sickness, or nausea. These medications are often given to patients who experience vertigo, imbalance, or nausea, particularly in conditions involving the inner ear. A frequently used example is meclizine antivert, which is commonly prescribed for benign positional vertigo. While it may reduce symptoms in the short term, meclizine has significant anticholinergic properties and can cause drowsiness, confusion, and reduce concentration in older adults. Similarly, dimenhydrinate dramamine, widely used for motion sickness, is also a strong anticholinergic agent. Regular use can increase the risk of cognitive impairment and falls, especially in individuals who already have balance problems. An important consideration is that not all dizziness requires medication. Many older adults experience lightheadedness due to orthostatic hypotension or as a side effect of other medications, conditions that will not improve with anti-vertigo drugs. In cases of positional vertigo, specific exercises and vestibular physical therapy often provide more durable and safer relief. Therefore, accurately identifying the underlying cause of dizziness before prescribing medication is a critical component of appropriate care for older adults. 7.5. Medications used to treat itching. Another group of anticholinergic medications commonly used in older adults includes drugs prescribed to treat itching, particularly oral antihistamines from the older, first-generation class. These medications are often given when patients complain of persistent itching that causes discomfort and disrupts sleep. Common examples include diphenhydramine and hydroxyzine visceral. Both have strong anticholinergic effects and can cause drowsiness, confusion, dry mouth, constipation, and adverse effects on memory, especially with frequent or long-term use. It is important to recognize that in older adults, itching is not always caused by allergies. In fact, many cases are due to dry skin, a very common condition with aging. In such situations, improving skin hydration, using appropriate moisturizers, and adjusting daily skincare routines can provide significant relief without the need for oral medications. When medication is necessary, topical treatments or drugs with lower anticholinergic activity are generally safer options for older adults. Therefore, before using oral anti-itch medications, patients should discuss the underlying cause and treatment alternatives with their physician to minimize risks to long-term brain health. 7.6. Medications for neuropathic pain. Tricyclic antidepressants, another anticholinergic drug group that older adults should be aware of, includes medications for neuropathic pain belonging to the class of tricyclic acetyl antidepressants. Historically, these drugs were used not only to treat depression, but were also commonly prescribed to manage various forms of chronic nerve pain. Two frequently encountered medications in this group are amitriptyline LV and nortriptyline pamela. While these drugs can reduce pain by acting on the nervous system, they also have pronounced anticholinergic properties. In older adults, this can lead to side effects such as drowsiness, confusion, dry mouth, constipation, and negative effects on memory and cognitive function. For many years, tricyclic antidepressants were also used to prevent post-herpetic neuralgia following shingles. However, more recent research has shown that their preventive benefit is limited. Today, several newer medications have been shown to be both safer and more appropriate for older adults in the treatment of neuropathic pain. Therefore, if an older adult is currently using a tricyclic antidepressant for nerve pain, it is important to revisit this treatment with a physician reviewing therapeutic goals, actual benefit, and the possibility of switching to alternative options that carry a lower risk to cognitive health and overall well-being. 7.7. Muscle relaxants. The final commonly used group of anticholinergic medications includes muscle relaxants, which are often prescribed for back pain, neck pain, or muscle spasms. These conditions are common in older adults and can significantly interfere with daily activities. A typical example is cyclobenzaprine, Flexeril. Although it can help reduce muscle spasms, cyclobenzaprine has strong anticholinergic properties, making it less safe for older adults. Common side effects include drowsiness, dizziness, confusion, dry mouth, and an increased risk of falls, particularly with frequent or prolonged use. It is important to note that muscle relaxants have not been shown to be clearly more effective than other treatment options for back or neck pain, such as appropriate movement, physical therapy, heat therapy, or the use of standard pain relievers. In many cases, non-drug approaches provide more durable benefits, with far fewer risks for older adults. For these reasons, in older individuals, muscle relaxants should be used only for short periods if truly necessary and under close medical supervision. Prioritizing safer treatment strategies helps reduce the risk of negative effects on memory and overall cognitive function. 8. One medication that deserves special attention, paroxetine. In addition to the drug groups already discussed, there is one anticholinergic medication that warrants separate attention because it is often mistakenly assumed to be safe for older adults. Paroxetine, commonly known by the brand name Paxil. This medication belongs to the SSRI class, selective serotonin reuptake inhibitors, and is frequently prescribed to treat depression and anxiety disorders. What makes paroxetine noteworthy is that, unlike most other SSRIs, it does have significant anticholinergic properties. As a result, in older adults, Paxil can produce side effects similar to those seen with other anticholinergic drugs, including drowsiness, confusion, dry mouth, and negative effects on memory. In geriatric practice, paroxetine is rarely a preferred option. When an older patient is taking this medication, geriatricians often consider transitioning to other SSRIs with a safer cognitive profile, such as escitalopram, Celexa, or sertraline, Zoloft, depending on the individual's clinical situation. Commentary. The fact that a modern medication like an SSRI can still have anticholinergic properties underscores an important principle. Not all newer drugs are equally safe for older adults. Each medication must be evaluated based on its real-world effects on the aging brain, rather than on its general drug classification alone. 9. Who should be especially careful about anticholinergic medications? Although anticholinergic drugs are widely used and are not always absolutely contraindicated, certain groups of people should be particularly cautious because of the elevated risk of negative effects on brain function. The first group includes individuals who are already concerned about their memory or thinking ability, such as those experiencing frequent forgetfulness, reduced concentration, or a general sense of mental cloudiness. In these individuals, anticholinergic medications can make such symptoms more pronounced. The second group consists of people who have been diagnosed with mild cognitive impairment, dementia, or Alzheimer's disease. Their brains are already vulnerable, and further suppression of acetylcholine can accelerate cognitive decline and make symptoms more difficult to manage. The third group includes individuals who are actively trying to reduce their risk of developing Alzheimer's disease or other forms of dementia in the future. Current evidence suggests that long-term use of anticholinergic medications, especially at higher doses or over extended periods, is associated with an increased risk of dementia. For these populations, early identification of anticholinergic medications and a proactive discussion with a physician about safer alternatives represent an important step in protecting long-term brain health. 10. Risk depends on dose and duration of use. The risk that anticholinergic medications pose to memory and brain function is not the same for everyone. It depends largely on cumulative exposure over time. Research shows that the risk increases when these drugs are taken at higher doses, used frequently, and continued over many years. Occasional or short-term use of anticholinergic medications, such as taking them only when truly necessary, is generally far less concerning from a long-term perspective. In these situations, the risk to brain health is considered low and is unlikely to result in lasting effects. For individuals who have been using anticholinergic medications regularly over an extended period, it is important not to panic. What has occurred in the past cannot be undone, but meaningful benefits can still be gained by making changes moving forward. Reducing the dose, lowering the frequency of use, or discontinuing the medication when appropriate can help limit further risk accumulation. A sensible approach is to focus on reassessing current medication needs, carefully weighing benefits against risks, and exploring safer alternatives whenever possible. Even small, timely adjustments in medication management can make a meaningful difference in protecting long-term brain function, especially in older adults. 11. What should you do if you are taking anticholinergic medications? If you discover that you or a loved one is using anticholinergic medications, the most appropriate approach is to systematically reassess their use rather than stopping them abruptly. For over-the-counter medications, if they are used only occasionally and are not medically necessary, individuals can often choose to stop or limit their use. However, if these medications are being taken regularly to control ongoing symptoms, it is still important to proceed thoughtfully and explore safer alternatives. For prescription medications, patients should not stop or reduce the dose on their own. Any changes should be made under the guidance of a physician or pharmacist to avoid withdrawal effects or worsening of the underlying condition. Openly discussing concerns about memory and brain health with healthcare providers is a critical step toward finding an appropriate solution. A particularly helpful strategy is to clarify the original purpose of the medication and then ask whether other options, such as non-drug approaches or medications with a lower cognitive risk, might address the same problem. When patients actively participate in decision-making and engage in open, informed discussions with their clinicians, they are far more likely to arrive at treatment plans that are both effective and safer for long-term cognitive health. 12. Final message: identifying and limiting the use of anticholinergic medications is an important component of healthcare for older adults, especially when the goal is to protect memory and long-term brain function. However, This does not mean that these drugs must be avoided at all costs in every situation. In certain circumstances, anticholinergic medications may still provide clear and necessary benefits, particularly when other treatment options are ineffective or inappropriate. In such cases, continued use can be reasonable if the benefits clearly outweigh the risks, and if the medication is taken at the lowest effective dose and for the shortest possible duration. Equally important, patients should not feel anxious or guilty if they need to use an anticholinergic drug. Instead, attention should be directed toward other proven strategies that support brain health, such as good management of chronic conditions, regular physical activity, mental stimulation, adequate sleep, and maintaining strong social connections. Ultimately, increasing awareness among older adults and their families about anticholinergic medications empowers them to become active partners in healthcare. Being informed enables them to ask questions, engage in meaningful discussions, and make thoughtful decisions alongside healthcare professionals. This proactive involvement plays a crucial role in improving quality of life and safeguarding brain health throughout the aging process.